Good evening, everybody. My name is Matthew Cronin, and I'm the Municipal Sector Coordinator for CUPE in Ontario, and I'll be your moderator this evening. We're going to wait a minute for everybody to get in on the call. Please note that there's simultaneously French translation is available, which you can access anytime by clicking the globe button in the Zoom menu at the bottom of your screen. Okay, I think we'll get started. I'd like to invite Fred Hahn, President of CUPE Ontario, to introduce everyone.
Thanks for that, Matt, and welcome everyone. Thanks for being here. I'm Fred Hahn. I'm the President of CUPE Ontario, and I am zooming in from the traditional territory of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. We're joined this evening by CUPE Ambulance Committee of Ontario Chair Pete Joseph, CUPE National Health and Safety Representative Paul Sylvester, Goldblatt Partners lawyer Daniel Shepard, infectious disease expert Dr. Tara Moriarty, and CUPE emergency medical services workers like you from all across the province. We're here tonight to talk about vaccine policies in the EMS sector and what they ultimately mean for all of you. Before I begin, I sincerely want to thank all of you from the bottom of my heart. Paramedics and ambulance communications officers are heroes in our communities. They were before the pandemic. They certainly have been during it. Full stop. Your communities, all of us in communities, all of you, not only our gratitude, but as your union, we also owe you the best representation and the best activism, the best advice we can provide, and our best understanding of these policies in our workplaces. Tonight, I want to remind you that from the beginning, our union has always been clear. Vaccines, we believe, are both safe and effective. It's not just we who believe this. It's the majority of people around the world. We've encouraged and said that everyone who can be vaccinated should do so. But we also know there are still people who are hesitant. We want to listen to those who have questions, and we will defend the rights of those who are exempt. I want to underscore that this webinar is your opportunity. It is a safe place to ask questions, to come forward without any sort of fear of ridicule or retribution. We are your union. We are here to support you and to represent you now and always. We have been going through this last 20 months together, and we will keep going through it together, particularly with amazing staff like Matt and Alia, amazing leaders like Pete, and so many wonderful folks from outside our union who are helping to support us, like Tara and Daniel, and of course, staff like Paul, our health and safety specialist. So I'm going to turn things over to Matt to get things started. I sadly won't be able to stay for the entire webinar tonight. It conflicts with another event that I have to go to, but I know you're all in good hands, and I wish you all a very good evening. Matt, back over to you.
Thank you, Fred. This is an important town hall on an issue that has understandably attracted massive controversy. Questions can be posted at any time using the question and answer feature in the Zoom webinar. Questions can be posed anonymously. Our team will gather them and repeat them without attribution at the end of the presentations. We will try to get through as many as we can. This evening, we'll refer to helpful resources from CUPE National and elsewhere. They will be made available for your information at qp.on.ca vaccine policy info. The recording of tonight's town hall will also be available at that link for those who are unable to attend. I would now like to invite Pete Joseph, Chair of the CUPE Ambulance Committee of Ontario, to say a few words. You can go ahead, Pete.
Thanks, Matt. First off, I want to thank all of you joining us tonight. Thank you, paramedics, dispatchers, support staff. Everybody has done an amazing job over the last years here, especially dealing with the pandemic. As Fred mentioned, this is a topic obviously of controversy. We've seen many different locals speaking out in regards to the issue. We see a variance of policies throughout the province. We see some employer policies that don't allow our members to work. We see policies that allow our members to work. We have members that are first in line for vaccines, and we have those that are still hesitant or those that still refuse the vaccine. No matter the decisions of our individual members, CAECO is here to support all locals and members. We can and should all work together and support each other. Again, thank you for joining us tonight, and I really hope everybody gets something out of this town hall. Back over to you, Matt.
Thanks, Pete. I would now like to invite CUPE National Health and Safety Representative Paul Sylvester to make his presentation. Go ahead when you're ready, Paul.
Thank you, Matt, and thank you to all of you who continue on the front lines against COVID-19. It's, thanks is not enough to praise you for the work that you do day in and day out. I wanted to just address a few areas where we often get questions around the Occupational Health and Safety Act and as it relates to the vaccine policies that are out there. We get a lot of questions around sections 28 and 26, which talk about medical surveillance. And in section 28.3, it does mention that a worker is not required to participate in medical surveillance. It's important to note that the Act talks about prescribed medical surveillance, which means that prescribed means that it's required. It's a requirement under the regulations, and there are regulations under the Act that provide that for people who work with certain toxic chemicals and biological agents that they can routinely submit to medical examinations by a health professional because of the nature of the toxic substances that they work with. However, an employer could not compel a worker to participate in those medical surveillance programs. So it is not a vaccine policy, and disclosure of your vaccination status would not be considered to be prescribed medical surveillance because it doesn't fall under the Act. Another section in which we're getting a lot of questions is section 63, subsection 2, which speaks to the employer gaining access to a health record of a worker. This particular section of the Act doesn't apply to vaccine policies. It's not likely to apply to vaccine policies on a couple fronts. And one of the main ones is that the employer can, should there be a statute that requires the employer to gain a worker's health record, they could do that if it's required under law. The current Reopening Ontario Act, one of the regulations under Schedule 1 of 364.20 regulation, I believe it is, says that an employer shall comply with the instructions or recommendations or directives given by the Chief Medical Officer of Health. It is quite likely that if it was to be challenged and it was to be established that a disclosure of a vaccine status was a health record, it would quite likely be exempted because there is already instructions that have been given by the Chief Medical Officer of Health. So that particular section would not apply as well. we're going to, in a few minutes, we're going to hear from Dr. Moriarty, who was going to speak a little about the Omicron or Omicron. There's different ways of pronouncing it, the variant that is out there. It's important that we, we're not, there's a lot that's unsure and a lot that we don't know at this point. So it's important that we maintain whatever current levels of PPE that's being provided, that we have access to the N95 respirators or elastomeric respirators. If the PCRA demands that an increased protection is required, we must maintain whatever precautions are in the workplace now. And if there's been some assessments or some evaluations that have found gaps, in particular where workers have been exposed, we need to seal those gaps and find out what are the systemic reasons as to why those gaps exist. And that involves your Joint Health and Safety Committee that is obtaining information about workplace injuries, workplace illnesses, incidents, so that they're better able to make those recommendations based on the evidence and based on the precautionary principle. So I'll leave it at that, and I'll be happy to answer any questions that you might have.
Thank you, Paul. We will now hear from Daniel Shepard from Goldblatt Partners, who will speak about legal issues concerning vaccine mandate policies.
Good. Thanks, Matt. And thanks everyone for giving me the opportunity to speak to you today. So my name is Dan, and I'm a lawyer that has spent the last many months following the legal developments that have been occurring with respect to the COVID pandemic. I'm not going to give you a comprehensive presentation. I think having done a few of these CUPE town halls, it's much more useful to everyone for me to answer the questions that you have and try to respond to the uncertainties or some of the things you've been hearing on legal issues. So maybe I'll just give a bit of an overview about where it is that I'm coming from in dealing with these legal issues. And then a high-level overview of some fairly recent legal developments over the last week or two. My philosophy when it comes to doing these town halls is pretty simple. I am not here to tell anyone what they should or should not do. That's not really my job as a lawyer. What I'm here to do is to give you the best information I can about what the law is, and what the consequences of choices that you may make are going to be. Because the reality is that all of you are facing choices. For those individuals who have not become vaccinated, you may feel the pressure as time goes on to become vaccinated, and you'll have to choose whether or not to do that. That choice is yours to make. It's only fair for you in making that choice that you have an accurate, up-to-date understanding of what the law says about what may happen to you as a result of that choice. So I'm not here to defend the law as being fair or unfair, good or bad. I'm just here to the best of my ability to give you an accurate picture of what the law says so that you can make choices for yourself, understanding what are the likely consequences that you will face as a result of those choices. And for anyone who's seen me do one of these town halls before, the other thing I always say is that there's a high degree of uncertainty in answering these questions because the pandemic is, from a legal standpoint, quite new, and that there's a lot of outstanding questions, particularly with respect to vaccines, that we simply don't know the answer to yet because courts and arbitrators haven't given us those answers. Well, that's changed a little bit, at least. Over the last 2 weeks or so, we've actually started to get the first wave of decisions from courts and arbitrators. We've received a few court decisions on injunctions, people going to court to try to prevent employers from implementing vaccine policies. And we've received about four and a half, depending on how you count, awards from labor arbitrators reviewing employer vaccination policies. And so there's a little bit more clarity in terms of the law, but only a little bit more. Because looking at all of the decisions that have come out so far, the big overarching rule that we can kind of take away is that context matters. And that what the outcome is going to be for one workplace is not necessarily going to apply to a different workplace. That the nature of the work, that the nature of the policy itself, that the current state of public health, that particular language and collective agreements, that surrounding legal obligations, and indeed the specific history within an individual workplace about outbreaks in the past. All of that is relevant in terms of what it is that an employer can and cannot do in order to implement a vaccine policy. So I'm going to hopefully be able to answer your questions with a little bit more of a firm basis, because there have been some arbitrators who have told me some things that I've paid attention to now. But at the end of the day, there still remain very few kind of universal truths. It still is very much the case that the answer to some of these questions is going to depend on the very specific facts of individual cases. However, in your sector, the ambulance sector, there is one thing that is a little bit different from most other sectors, and that's Directive 6, issued by the Chief Medical Officer of Health. This is a directive that requires a number of different types of employers, hospitals, long-term care, and importantly to you, ambulance services under the Ambulances Act, to implement certain kinds of mandatory vaccine policies. There's flexibility in terms of what those vaccine policies can require and what they must contain. However, it is one of the few universal truths out there that all of your employers are required by law to have at least a certain kind of vaccination policy in place. And that's an important constraint that's going to impact what it is that employers can and can't do in your sector. I know that ambulance services across the province have implemented Directive 6 in a lot of different ways, and there are a lot of different policies out there. And I'm happy to address kind of different aspects of different ones. But I just wanted to provide that general overview for you so that when we get into your specific questions about how particular laws work or what are employers allowed to do and not allowed to do with respect to a variety of different things we're seeing in these policies, we're at least all starting with the same general understanding of what's the lay of the land in terms of the legal rules that apply to vaccines. Matt, so with that, I'll flip it back to you and to everyone here today. I really do look forward to hearing your questions and hopefully having a chance to answer them.
Thank you, Daniel. We'll now hear from Dr. Tara Moriarty, an infectious disease expert and director of the Moriarty Lab at the University of Toronto.
Thank you very much. I think some of you may have met me or seen me in these town halls before previously. And you may or may not know that I generally prefer to answer questions directly too. I think that's why everyone's here. But I wanted to let everyone know that, first of all, an organization that I run called COVID-19 Resources Canada provides Q&A sessions, anonymous free Q&A sessions that you can join 3 evenings a week and drop in if you have questions about the safety of the vaccines. These are staffed by volunteers like me, scientists, doctors, pharmacists, nurses. And we also have a program for people who want to have vaccination conversations and are finding that there's a lot of conflict around these. So we're trying to help a lot of people who are vaccinated understand the importance of not damaging relationships with people and of coming together and finding a way to have these conversations that doesn't destroy those relationships, whether that's in the workplace or within families or among friends. So I'm an infectious disease researcher, and you can ask me any questions about the vaccines, but normally I don't do this, but I actually want to today talk to everyone about Omicron or Omicron, or depending, none of us have just settled on a way of saying it, and some more evidence that's coming out today that is really making it fairly sure now that this is likely going to be spreading twice as fast or 50% faster than the Delta variant. So the very real concern right now is that this strain is going to spread so fast that it's going to reach people who are unvaccinated faster than previous strains. And there are many, many things we don't know. It's looking like it has some immune escape from the vaccinations that exist. And that, if that is true, that's going to be a problem because things will spread faster. But what I do want to say to all of you is that if you're over 40 and you're unvaccinated, the risk of really severe outcomes from COVID-19 is actually quite high. And there's a very good chance that you will be exposed to the virus fairly quickly. And I think paramedics sort of will understand what, a massive fast moving wave might mean. But I know there's a lot of misinformation out there, but what I want to tell people is that, in Ontario right now, 1 of 78 people 40 and older who are unvaccinated will likely die from COVID-19. That 1 of 58 people over 40 will end up in the ICU, assuming that all of us together are 40 or older, which anyway, most of the people I can see look like you're over 40, no offense. That would mean that one of us in this whole group, including the participants, could end up being in an ICU. And 1 of every 17 of us will end up in hospital if we're unvaccinated and over 40. So you can do with that what you want, but I also want to make sure loud and clear that people understand the personal risk and that the vaccines we don't know what they're going to be like with Omicron. Right now, they provide 90% protection against severe outcomes and death. And I actually want to appeal to you, if you're over 40, to consider being vaccinated to protect yourself and your own life, and for people who love you. And that's it. I won't come back to it again. I know that people have a lot of concerns, but I just want to tell you how serious the situation is, and that many of us may end up being exposed, if we haven't been already, a lot faster than we maybe realize. So this is quite a serious time right now. And that's it.
Thank you, Dr. Moriarty. We will now be answering some questions submitted through the Q&A panel. I want to remind everyone that your questions can be submitted anonymously and will not be attributed publicly. We will strive to answer as many questions as possible in the time that we have. In that spirit, please note we will be grouping similar questions together. So let's begin. So just give me a second here, because I'm doing this live on the go. If the person sitting next to me in a communication center is a member that has not been vaccinated, based on the limited amount of space in our workplace, what are my rights in terms of a work refusal? So I suppose this go to Mr. Shepherd or Mr. Sylvester.
I'll start, and I know Paul will follow up if I miss anything, and I probably will. I mean, the first thing to say is that you probably shouldn't know if the person sitting next to you is or is not vaccinated. Vaccine status is personal health information, and so employers, ought to be keeping that information confidential. It shouldn't be spread to anyone who doesn't have a specific need to know in terms of what an individual's vaccine status is. So, I want to answer your question, but part of the premise of the question I did want to address, because that sort of thing ought not to be kind of common knowledge within the workplace, unless an individual chooses to disclose that to their colleagues. In terms of the Occupational Health and Safety Act, so there's a right to refuse unsafe work under the Occupational Health and Safety Act, and there's a corresponding duty on the employer to take all steps that are reasonable in the circumstances for the protection of a worker under Section 25 of the Act. What your rights are going to, as a practical matter, depend on a wide range of things. So your employer has to take steps to make sure everyone is safe. universal masking, physical distancing, at least where possible. I think, with the information we have on fluid dynamics and aerosols, we really want to make sure ventilation is operating as efficiently as possible inside enclosed locations. So, there are a wide range of things that your employer has a duty to do in order to protect you. If they're doing those things, as a practical matter, you do have the right to make a good faith work refusal, and the Occupational Health and Safety Act sets out a fairly complicated set of rules and principles that apply and a process that has to be followed. But if the employer is doing everything to keep the workplace safe, the reality is that your refusal is likely to be refused at the end of the day. So, what I would say to individuals who have those types of concerns is, from a practical perspective, you ought to be doing things like, working with your local rep and asking the employer and through the Joint Health and Safety Committee to make sure that all of those measures that can be taken to protect everyone, whether or not individuals sitting next to you are vaccinated, are being taken, because quite frankly, they should be doing everything to protect you, even if everyone in the building is vaccinated. That shouldn't make a difference in terms of what the duty on the employer is. So in order to just protect workers effectively, those conversations should be taking place and should be pursued wholly independently about then concerns about vaccine status of colleagues.
Yeah, I was going to agree pretty much dead on what Daniel was saying. The only thing I would add is that those who are employed have to remember that those who are employed for an ambulance service have a limited right to refuse where circumstances that you're faced with aren't inherent in the normal work that you do or not a normal condition of employment, or where the refusal would directly endanger the life, health, and safety of another person. So those things have to be considered as well. And as Daniel mentioned, we shouldn't just jump to the work refusal. If you have concerns, they have to be brought forward to your supervisor. If your supervisor is unable to take care of them, you have your outlets of your Joint Health and Safety Committees to address your concerns. And to ensure that the employer is taking every precaution reasonable, but the vaccination status is not what would be called like a game changer for work refusals.
Thank you. We have a person in the chat that's asking about natural immunity. They are wondering if natural immunity gives better protection than the vaccine. If so, why are employers not accepting natural immunity in lieu of proof of vaccination? So Tara, could you speak to the question of natural immunity? And then Dan, do those with natural immunity have a legal case to remain working if they don't want to get the vaccine?
That's a really good question. It's one we hear all the time. So there are a lot of people who believe that natural immunity is better than vaccination. It sort of depends. People will sort of say that they describe it as better. We do have data now that give us an idea of the type of immunity that results from vaccination versus from natural infection. So one thing we know about natural infections, where you're infected, and by the way, all immunity is natural, whether you get it from a vaccine or whether you get it from the virus itself. So when you get infected by the virus, about a third of people don't really develop a lasting immune response to the virus. This is something we've known about the virus that causes COVID-19 for a long time. So about a third of people don't develop lasting immunity when they're so-called naturally infected. And then when it comes to vaccination and the duration of immunity in people who have developed an immune response, who have been infected with the virus, we know that the vaccination provides longer lasting immunity at this point, or longer lasting protection against severe illness and death than the infection itself. And we also know that that the vaccines provide they don't completely protect against transmission, but they prevent about 75% of transmission. And what you're starting to see now in some places is some waning of that protection. We're not seeing a lot of it yet in Canada in younger age groups, possibly because our vaccination intervals were more spaced out. So what I can say is that right now vaccination is proving to provide longer lasting protection against severe illness and death, and quite a bit more protection against transmission than infection with the virus itself. However, it's also looking like these vaccines, like many vaccines actually, are likely going to require 3 doses to maintain their protection against severe illness and death. So a lot of people think that so-called natural infection is better, but in fact, we now have evidence indicating that it's not. It still provides some protection, but a third of people won't have any at all. And those who do won't have as long lasting protection as the vaccines, as people who are vaccinated, and they're going to transmit more.
On the legal side of things, based on what Dr. Moriarty is describing, the answer is probably no, that having a history of infection probably doesn't give workers a particularly strong basis on which to argue for a different type of workplace mandate. So the employer is going to have interests, what arbitrators would view as legitimate employer interests in issues not only of protection of the worker, but also in terms of risk of a worker transmission to others, both with respect to other workers and also, particularly in the ambulance sector, transmission to members of the public. And so to the extent that there is a meaningful difference between transmission consequences from infection versus immunization, that's going to be weighed pretty heavily against a claim that one could that it's unreasonable not to accept natural immunity as an alternative. The other thing that strikes me, and Professor Moriarty, maybe you can or at least answer this, when it comes to the 1/3 of individuals who don't seem to develop long-lasting infection, can we predict who those people are?
So this is not known with certainty, but one of the things that we know most clearly is that people who didn't have severe disease the first time are the ones most likely not to have lasting immunity. So if you've been severely ill with COVID and recovered, you're more likely to have immunity that lasts longer. But if you've had a very mild infection without a lot of symptoms, or even, certainly not symptoms that landed you in hospital, you're more likely to be one of the people who doesn't have lasting immunity. And we don't quite know exactly how that breaks down further. There's a lot of effort to try to understand who doesn't develop immunity, but certainly if you're healthy enough to work, and if you didn't have a really serious COVID episode when you were sick, there's quite a decent chance you might be someone who doesn't have great long-lasting immunity. It's all, it's not totally black and white, but that's the current data right now.
So like my reaction as a lawyer to that is that kind of adds an additional layer of problem, because employers are going to have the response that employers are going to have to claims for more type of individualized assessments is that they really need to have a blanket rule in order to be able to administer it in a sensible way. And the more you have to have a case-by-case assessment, the more difficult it's going to be to convince either employers or arbitrators that it's a reasonable requirement. The reality is, we have a human rights code that imposes a duty to provide individual assessments in certain circumstances to individual, to accommodate individual workers. If employers were happy to do individual accommodations on their own, we wouldn't need a human rights code. We have it because employers don't like to do that sort of thing. Having a infection-based exemption regime is also going to run into a lot of opposition, because how is the employer to, one, know that whatever sickness you had before was in fact COVID as opposed to something else? Two, is it serious enough of an infection you had to make it at an acceptable level of probability you have developed a high degree or a long-lasting level of immunity? So, those types of concerns, I think, are going to, make it even more problematic to claim that this is going to be something that employers have to do. I think most arbitrators are going to be far more comfortable with kind of clearer, more bright line rules, like two doses of a Health Canada or WHO approved vaccine versus not, like having more clear dividing lines. So I think
Yeah, and
that's has to be added to the mix.
Yeah, and if I can add to that, a complicating factor is that if, for example, someone wants to confirm that they've previously had COVID-19 using antibody testing, part of the problem is that, like any infections, our antibodies decline over time. And so you might well have had COVID-19, but say you want to prove that you've had it to be able to obtain an exemption. The likelihood of those antibodies declining over time and not being detectable are it's pretty significant. And the longer you go from the infection, the more likely that is. So it could end up also being something where you could be in for quite a surprise, that you might show up as not having been exposed because your immunity has declined over time and you don't really have a lot of evidence of it anymore. So that also complicates it, is that COVID infection itself doesn't produce really strong lasting immunity in quite a few people.
Okay, thank you. The next question is about the distress that's caused from the full approval from the vaccines from Health Canada. So Dr. Moriarty, if you could speak to that. And then the legal part of it would be, can the employer force the vaccine that hasn't been given for approval onto workers?
Sorry, I'm just reading the question to make sure that I understand. So this, I believe that this question is about whether the vaccines are experimental or not. So for example, the Pfizer vaccine that many of us receive and have received is fully approved by the FDA in the US. And Canada is processing the paperwork for it, but there is no evidence from any country in the world that it's not going to receive that full final approval. It was originally released under, all the safety studies had been done, but it was an emergency use authorization. All of these vaccines were released under to begin with. And we have so much data now from around the world, the sheer numbers of vaccinations, that the sort of the full approval or authorization hasn't been completed yet in all places, but the FDA has, certainly for the Pfizer, and they're going to, they're clearly are not, the safety signals that were a concern for different vaccines were seen as more people were vaccinated, but it's been a long time now that there's nothing new that's come out, and we've had many millions of doses delivered. So they're not considered experimental in any sense. But I did want to reassure people. So a lot of people think that vaccines can have long-term side effects, but actually, maybe I can explain a little bit about how a vaccination or immunization works. So something is introduced into your body, just like it is when you have a cut or anything that introduces something into your body. And your immune response responds to it and says, okay, this is something we don't want here. I'm going to react to it to get rid of it. And I'm going to develop memory to it so that if I ever see it again, I'm going to be able to respond to it. But the thing that goes into your body doesn't last. So for example, the mRNA vaccines are gone from your body within 48 hours. They break down, they're made out of something that's so inherently unstable that it actually lasts in your body for a lot less time than conventional vaccines. What does last is your immune response to it. So at times there can be issues with immune responses to vaccines or infections or allergens or other things where people can have a prolonged, they develop a sensitivity or something like that. That can happen with vaccines, just like it can happen with any environmental things, foods, any kinds of products, and that can happen in certain people. But it's because of your immune response. So it's not specific to a vaccine itself. It's just that sometimes our bodies respond in a way that sensitizes us to certain things. What I can say is that the allergic response profile of the mRNA vaccines has actually been better than pretty much any preceding vaccine in history, probably because they have very, very small number of ingredients compared to most vaccines and because of the way they're produced. So they have very few ingredients that induce potent immune responses. And very few ingredients that anyone in the world is allergic to. So even though we're all very aware of stories and concerns, it's actually, so for example, if you think about myocarditis, even in children or even kids 12 years and older, you're more likely to develop myocarditis from COVID itself at that age than you are from the vaccination. And it's a very rare event. So we hear about it and we pay attention because we're all riveted to this and thinking about it all the time. But these events are actually very rare. And in the case of myocarditis, fully treatable as well. So if they're recognized, they're easy to treat, they happen in response to a number of different infections. So as long as we know that it's there, it's important because then we watch for it and we know what to recognize and how to treat it. So I'm not sure if that entirely answers your question, but these vaccines are extraordinarily safe, and we have more data about these than I think than we've had about I don't know, most medical products, more, than just about any other medical product in human history at this point.
And on the legal side, any court or arbitrator is going to view the currently approved vaccines in Canada as being approved, fully approved. That is how they will be treated. There's a lot of misunderstanding about how the approval process works by Health Canada under a law called the Food and Drugs Act. In particular, when the vaccines, people started, applying for vaccine approvals, there was something called an interim order that was made under the Food and Drugs Act. And I think a lot of people heard that and thought, oh, well, that means that these vaccines have only received interim approval. And that's wrong. It's just the name of a order that Health Canada issued that changed the application process, that prioritized in terms of the when they get considered, prioritized COVID-related vaccines and other medicines and devices, and then also changed the process by which data was submitted for consideration. So through a rolling review process, as opposed to collect all your data and then hand it over in one chunk. So the interim order wasn't saying we're only giving interim approval and that maybe it's going to be disapproved in the future. That's actually not what happened. None of the arbitration awards has considered the particular question that you've raised about the current approval status. But that's really, in my view, a function of the fact that arbitrators simply would never accept an argument that these are somehow experimental or not valid vaccines. The evidence that is being put before them is that they are safe and effective, and I do not imagine, unless there is a dramatic difference development in data that's coming out, that any arbitrator or any court would base a decision on any conclusion other than the fact that they're safe or effective. Again, I'm not saying that any given person on this necessarily agrees with that, but you should understand. I mean, one, you should listen to what Tara has just told you, and then two, regardless of your views, understand that the decision makers in these cases will view these vaccines as both safe and effective, and that any decision will be based on those two things as being accepted.
Thank you. The next question is about any issues with WSIB, if there's been in terms of having adverse reactions to the vaccine, and do we know if there's been any WSIB claims approved or not? So as staff, I'm not aware. I've heard that members were going to submit WSIB claims. We don't have a WSIB specialist here on the call, but I would encourage you with your national rep to access our WSIB specialist that way. But there's other staff on the call. They can speak up if they're aware of that. And then Dan, if are you aware of anything in terms of WSIB approvals for reactions?
Yeah, I mean, WSIB, it is an area where you really do need a specialist. It's not a fun area of law to try to dabble in. My advice will always be for individuals who do have adverse reactions to vaccines, particularly in sectors like ambulance, where there are things like Directive 6 that make these policies mandatory, and that it really does feel like everyone has to be vaccinated. You absolutely should be applying to WSIB. There's no reason not to. I'm aware that there certainly have been applications that have been made in a variety of sectors. I know that there certainly is some pushback. WSIB doesn't want to approve them. There have been cases where there have been approvals. I've heard anecdotally that there have been some approvals and there's been some reconsiderations. I have not heard of any decisions coming out of the WSIAT. This is the appeal body that sits above the WSIB. I haven't heard of any WSIAT decisions on this in particular. So I think we're still in an area where there's going to be a lot of uncertainty about how these are going to play out. But particularly given the circumstances in the ambulance sector, if there are adverse reactions to vaccines, 100%, you really should be applying to WSIB.
Okay, the next question, I'm going to skip ahead one question and then kind of combine two. One, it says, in municipalities, there are other businesses and functions run by the municipality, social services, courts, etc., in addition to paramedics, and where paramedics are required to be vaccinated because of Directive 6. So can the employer, that's the Ambulance Act, so can the employer use Directive 6 as justification for a mandatory vaccination policy for the whole organization, even though it is part of the organization that directly falls under the directive? And then, so the next question is basically, at the end of the day, would it be fair to say, unless you have a medical exemption or CREED exemption and are a paramedic, you must be vaccinated to remain employed? So that one's for you, Dan.
Very simple and clear answer. It depends. Look, there's no easy answer to that. To start with the first part of the question about the impact of Directive 6 on other aspects of a municipal employer. Certainly, I think that a municipality might try to make that argument. But ultimately, the question is any given vaccine policy reasonable in all the circumstances? That's what the labor arbitrator is going to consider. When it comes to ambulance, that consideration is constrained by Directive 6, right? When an arbitrator thinks, well, what are the reasonable alternatives that might exist? No vaccine policy or vaccine policies that don't comply with Directive 6 aren't on the table, because Directive 6 is the law. It has to be complied with. For other aspects of a municipal employer, though, they potentially have more flexibility, and so there may be more alternatives that an employer could consider. So I don't think Directive 6 is necessarily going to dictate what's going to happen in other emanations of the municipality. As I say, what is reasonable, what is not reasonable is context specific, and a huge part of that context is what is the nature of the work being performed, where is it being performed, what is the history in the individual workplace, the physical workplace, what's the history of outbreaks and safety measures that have been taken. So I wouldn't assume that just because Directive 6 sets out one set of rules, that municipalities would be able to succeed in having those rules applied everywhere. But whether or not any given policy is or is not going to be upheld is going to depend on a whole host of individual factors. It may be at the end of the day that an arbitrator would say, yeah, what they're doing to ambulance is also reasonable in all these other places. But I don't think it necessarily is because of Directive 6. It's going to be because of a consideration of all of the surrounding circumstances in that workplace and whether or not the particular terms of the policy represent a fair balancing between employer interests in healthy workplaces, occupational health and safety, public health, and on the other hand, employee interests in personal autonomy and privacy. And then to the really fundamental question, can I continue to work? It's still not an easy yes or no question. And so let me try to break it down a little bit. You've put on the table CREED or disability accommodations. And so those are critical things. The Human Rights Code says what it says. People who either have a medical condition that gives rise to a serious risk of harm from vaccination, and that would primarily be allergy to one of the ingredients in the vaccine, have a right to reasonable accommodation up to the point of undue hardship. Equally so, individuals who have a CREED that prevents them or prohibits them from becoming vaccinated have a right to reasonable accommodation. And the discussion of CREED is a very complicated discussion. I'm happy to have it, but I'll just say, in those circumstances, you have to be accommodated. If we look at everyone else then, the people who don't have the medical or the CREED/religious accommodation claims, they may or may not be able to keep working if they're unvaccinated. And that's going to depend on, first, what are the specific terms of your vaccine policy? So under Directive 6, an employer can, if it chooses to, adopt a vax or test policy, right? They can have a policy that says for those workers who are not vaccinated and who don't have a Human Rights Code based exemption, they will still be allowed to work if they do two things. One, take an education session about vaccines and how they work and how safe they are. And then in addition to that, two, undergoing rapid antigen testing on a periodic basis. Directive 6 allows for those policies. It doesn't say that an employer has to adopt them. It just gives them the freedom to do so. And so for those employers who do adopt such a policy, then yes, there is an avenue for workers who are unvaccinated and yet don't have a Human Rights Code accommodation to continue to work. You just have to take the PanBio test and check every couple of days to see if you have an antigen response. There are going to be other workplaces, however, that have a stricter policy, that their policy is vax or exempt. So if you're not under the Human Rights Code, then you have to become vaccinated. In those cases, the question then becomes, well, is that policy reasonable or not? And there is no yes or no answer to that. I mentioned at the outset with my remarks at the beginning that we now have a couple of different arbitration awards in this area. And I can tell you, one of the arbitration awards upheld a everyone has to get vaccinated policy as reasonable. There was another award that not only said that an everyone has to get vaccinated policy was unreasonable because it had to provide an antigen testing alternative. It also said that discipline and unpaid leave of absence for those who don't comply was also unreasonable. But both of those decisions were based on very different sets of facts, very different types of employers, different types of workplaces, different collective agreement language. And so whether or not any particular policy is going to be upheld as reasonable or not will vary dramatically based on the context. Now, I will say one thing, because all of the awards do at least seem to accept, to the extent that they talk about this issue at all, that healthcare is different. Healthcare presents a particular set of concerns that are fairly unique when it comes to assessing whether or not vaccine policies are or not reasonable. And it may actually be useful, because I actually happen to have it on my screen. If I just read to you one comment from arbitrator Stout in a case called Electrical Safety Authority. And this is one of the awards that actually strikes down a mandatory vaccination policy. This is an award that says you had to give a testing alternative and you can't fire anyone based on their choices about vaccination. Arbitrator Stout, having said all of that, goes on to say, quote, in workplace settings where the risks are high and there are vulnerable populations, parentheses, people who are sick, or the elderly or children who cannot be vaccinated, close parentheses, then mandatory vaccination policies may not only be reasonable, but may also be necessary and required to protect those vulnerable populations. When he wrote that, I think he was thinking about hospitals, but I think that there's going to be many very good employer lawyers out there who are going to point to that and say the exact same thing applies in the ambulance sector, that you're dealing with an inherently vulnerable population. You cannot control what their vaccine status is, and you can't make choices about who to provide services to based on their vaccine status. And in those circumstances, that's going to be a pretty powerful factor that's going to weigh in favor of probably more aggressive vaccine policies. But having said that, it is going to come down to a case-by-case evaluation of your workplace, your collective agreement, and the details of your policy. So that's a long-winded way of going back to where I started, which was, it depends. There may be ways to continue to work and there may not. And I can't answer that in the abstract.
Okay, we'll try to get one last question here under the wire, and that's for Dr. Moriarty to comment on airborne precautions that employers should be taking and why Public Health Ontario is lagging behind the now accepted science on airborne.
So, well, I think there's probably a bunch going on in there. And I actually think that Paul is probably a very important person to help respond to this. So first of all, it's clear that we need airborne precautions, that filtration, ventilation, all of these are important, and that they're an important part of workplace safety. The trouble is that it's the devil is in the details. It's the implementation of this that can be challenging. And I'm positive that Paul has a lot more on the ground experience with different workplace sectors and how they are dealing with this and addressing this. This is not something I'm knowledgeable about. I'm knowledgeable about the science and what we need to be doing. But Paul can certainly tell you more about how employers are or are not implementing and what the process is to ensure that that there are basic protections in place.
Thanks, Tara. It's an important question because we've seen the Public Health Agency of Canada move towards a greater recognition of aerosol transmission. In Ontario, Public Health Ontario and the science table have been reluctant to fully declare whether or not they are stuck in the dichotomy between droplet and airborne diseases continues to be an issue, and it continues to be language that they're refusing to budge on for, as Tara mentioned, for many practical reasons. When you have a droplet disease, it's mainly incumbent on the worker to take protections with PPE and things of that nature. Once you start getting into airborne, now the employer has certain obligations as it relates to things like that are, outside of the worker, like things like ventilation, things of processes and how we move things through the workplace, air purifiers. And then we get into the whole discussion if we're going to call this an airborne disease or aerosol opportunistic disease, infectious disease. It comes down to, well, we need a higher level of protection. And that starts with respirators so that they can block out the aerosolized particles that are out there. CUPE continues to work with all our allies, continues to work on multiple levels in all sectors who are meeting with their prospective ministries that they report to. I can say that they're all pushing and pushing. They're working with the OFL. The OFL has a campaign. They have a campaign around follow the science, and that's what we all need to keep doing, is to keep impressing upon our employers that there's one thing that the PHO can say, and there's one thing that the science table can say, but the Occupational Health and Safety Act has a greater thing to say, and that is we're not going to wait until the science determines whether or not precautions should be available. We need to take every precaution reasonable in the prevention methods, and that starts with a greater level of protection, and it's just not extended just to respirators. It involves the employers to take greater steps along the path and at the source.
But in terms of what minimum standards are, that is, I mean, that's a room by room, like these discussions are, I don't think that we have any agreement about what minimum standards are. And I think what's important is that in some form or another, COVID is going to be with us for at least a couple more years, at least, right? And I think that instead of just hoping we're going to get through it and waiting for it to be over, I think there needs to be that mental transition to, if we, unless we get vaccines that completely prevent transmission and everything else, like we need these protections in place. And this is still going to go on for at least twice as long as it already has. So anyway, it's a really, really tough problem. But certainly the Occupational Health and Safety Act is the most important thing. And it's also very important that Health Canada and the Public Health Agency of Canada has come out and indicated that it's airborne, because that will give more teeth to some of these deliberations.
Thank you. That concludes our question and answer session for tonight. Thank you to all the panelists and for all of you for joining. Please visit cupid.on.ca/vaccine policy info, which I think Liam put in the chat, to access any of the resources we mentioned this evening. So thank you very much and have a good night.